Hi, I want to talk today about what is the difference between a clinical diagnosis of eating disorder and disordered eating. What is the difference? And I'm here as a provider to provide education. An eating disorder requires a clinical intervention of a treatment team, meaning there is a medical doctor, typically a psychologist, sometimes an internal doctor, sometimes a psychiatrist, a therapist, sometimes a case manager or a nurse, and typically a registered dietitian. So there are specific areas of expertise that each individual is going to come together to treat this multi-dimensional, very nuanced brain-based disease. Disordered eating is different. Disordered eating describes behaviors that can contribute to a clinical diagnosis. Most people have engaged in disordered eating, and disordered eating can be very disruptive. It can also be something that is typically not nourishing. It's not contributing to long-term health, yet it feels normal. So examples of disordered eating is going to be chronic dieting, intermittent fasting, which can be done productively, can also be done destructively. Weighing yourself daily or multiple times a day, having a very rigid set of counting food in order to change the shape of your body, binging on foods, intentional fasting after binging on foods, or intentional purging through induced vomiting or exercise after feeling guilty or binging on foods. And so there can be many different behaviors outside of the examples that I've given that, if done repetitively over time, can lead to a diagnosis which requires treatment for healing. There can be a land of this disordered eating where it necessarily doesn't cause disruption in social connections or maybe employment health or functional health, yet it can be disruptive where the noise in your head is so loud where you can't connect, or you have a hard time connecting with others or showing up in the workforce functionally, or it just feels like in order to quiet the noise, I need to engage in dieting behaviors. This would be disordered eating, and this can be a really hard place to live. And some people live there for a very long time, and they show up very functional in the home, in the family, in the workforce, but internally, their self-dialogue is really critical, is really tough, and there is a better way to live. There is a better way to live outside of that noise, and it is possible. This was helpful. Like and subscribe and follow along. I'm Dr. Patty Enford. Thank you.